So welcome all of you to this session. We are going to look at the concepts around public health ethics. And in this presentation, we are going to basically understand what public health ethics is, why is it very important, what is its scope, what are the historical issues around public health ethics, and then we shall pick a few areas where the public health ethics is actually very relevant. So public health ethics relates to the ethical principles and values that guide our practice. So in public health, we are involved in a number of activities. For example, we enact policies on health. We design public health promotion campaign. We conduct research. We health educate people. We design health messages and disseminate these health messages. So we do a lot of things. But while doing these things, we are often met with ethical issues that we have to deal with. So understanding public health ethics enables us to make the right decisions when we are confronted with such situations. So what situations do we actually meet? For example, we could be provided with resources to allocate for a health intervention, okay? We need to make a decision on who gets the resources, who therefore is going to benefit from these resources. Is there any harm that is going to be associated with the public health intervention that we have? And how are we going to navigate those things? Those questions that we actually have, those challenges that we are going to have. So we apply public health ethics. So therefore, public health ethics enables us to answer those questions. Questions of moral judgment or moral governance in relation to public health. Public health ethics enable us to know what to do and when and how to do it. And therefore, it enables us to make proper decisions that are right. And also, after making those decisions, we know what to do and how to do it. And then we apply public health ethics in also research and also in our professional conduct as professionals. So we apply professional ethics. So what you see is that public health ethics basically governs everything that we actually do. Okay, whether it is health promotion, whether it is doing research, whether it is designing health policies, whether it is designing health promotion and the health communication campaigns, whether it is about preventing the population from getting a deadly communicable disease, whatever you talk about, public health ethics has interest there. So what are the principles of public health ethics? The principles remain like those that we actually discussed yesterday. The first one being beneficency, which is that people have public health professionals need to work in the best interest of the individuals that they are serving or the populations that they are serving. You have to do good to them. That is beneficency. And then null maleficency is that you should not do something that is actually harmful to the communities or populations. And then that autonomy, that individuals have the right to make their own decisions as long as they have sound mind. And then the principle of justice is that resources should be fairly and equitably distributed. There should be no discrimination based on either race, tribe, socioeconomic class, or any other characteristic. Basically, resources should be fairly distributed. Fair distribution of resources does not mean that resources have to be distributed equally. Fairness does not mean equally. Fairness means that resources have to be distributed according to need. So a concept of social justice is the one that emphasizes fair distribution of resources, opportunities, and burdens. When we talk about burdens, we mean that public health in its nature may have challenges or issues that can arise. So, for example, let's look at who pays for health care. Okay, usually the government takes care of that. The government makes sure that the health workers are paid, the medicines are there, the health facilities are well furnished, the equipment is all there. But where does the government get this money to do all that? If the money comes from the taxes that you pay. So the taxes that you pay, that means it is a cost on you as the citizen. So it is a burden. So how is that burden shared? The rich usually charge more, they pay more taxes compared to the poor. So that is a concept related to how burdens are shared. And then we have the principle of public trust that has a public health professional, or even if you're working in public health institutions, you should make sure that you have the trust and the confidence of the public. And you can achieve this if you are transparent, accountable, and also responsible in decision making. That is very, very important. Professionally, as a public health practitioner, you should exhibit professionalism and trust. Shouldn't be a person who can easily manipulate the population. Should always ensure that the population is protected and that there are no safety issues in everything that you do, and that you are also a person who advocates for health justice and equity. This is to say that there are populations which are not having this similar health outcomes compared to the others. They are probably vulnerable populations, or what you can call marginalized communities. So you have to be a voice for them. So you should be an advocate of health justice and equity. And you should also realize that as a public health professional, you cannot work alone. You need to work with other people. So there is interdependence. You need to work with the community. You need to be in solidarity with the community. And then the other value that is very important is a value related to human rights and civil liberties. Everyone has fundamental human rights that should be respected. Now, let us discuss issues to do with the political philosophy of public health ethics. Basically, when we talk about political philosophy, we are talking about issues of governments and how they relate with the citizens and what political systems are available in a particular country, and how matters related to justice, power, authority, rights, and involvement of individuals in all these aspects. That is basically the scope of political philosophy. What is the justice system? How is justice administered? Who has power? How is that power used? How is that power used for the betterment of the population? What kind of authority different individuals have? And what rights are being respected and what rights are not being respected? These are all questions that are usually answered in political philosophy. So therefore, political philosophy is very important because it informs the kind of decisions that are made that are related to public health. So political philosophy has influence on public health policies and interventions. So we also use political philosophy to understand what the government does and what powers and authorities and what rights they have in protecting the population. So let us go deeper into this. For example, we have different countries that have different political systems. For example, you can have a socialist political system. We can have what you call a capitalist political system. What's the difference between these? A socialist political system is one where basically everyone should actually be taken care of regardless of their financial status. Okay, and the countries that have this kind of political system are those that actually provide healthcare to everyone at free. Okay, whether you're rich, whether you're poor, the government is done what provides you with the healthcare services that you want. That's a socialist political system. So this is therefore to tell you that politics is actually related to health. Politics is health, or public health is politics, if you hear those things. This is to say that the people who make the decisions on who receives what healthcare services are the politicians. They make those decisions based on their kind of thinking of how the country should be or how the country should be governed. And that is basically political philosophy. And therefore, if a country thinks that everyone should be taken care of, many issues of justice will be maintained, healthcare services will be provided to every community, regardless of whether they have the resources or not. So that is how political philosophy relates to public health, and therefore issues of social justice coming in. Someone is having a question. Samsung is, I don't know who is Samsung, who's using the Samsung gadget. He's saying he can't hear. Can you confirm that you can hear me? I believe most people should be hearing me.
I'm getting you loud and clear.
All right, good. So the person who's using Samsung, please check your gadget and see what problem you could be facing. So we go ahead. Okay.
Hello, excuse me.
Yes, someone is having a question.
Good.
Someone is having a question? If not, I'm just muting.
This is Anyara. You said someone using from some development?
Yes, I don't know who that person is. That person was writing a message that they can't hear, but we are loud and clear. So let's proceed. Suddenly, my mouse is jamming, but let me sort it. Just here. Okay, so let's move to the next slide. The next slide talks about what are the ethical challenges that you will find in your public. All right, I think my internet had gone off a little bit, but let's just continue.
So now is it okay?
Yes, I'm fine. All right. Someone is still having their mics on. Okay. Okay, fine. So the next issue that you'll encounter as a challenge in your practice of public health will be an issue related to ensuring that all populations have the same health outcomes like others. When I talk about health outcomes, I'm talking about issues to do with the number of deaths, the number of people with particular diseases, that is morbidity rates, and also issues to do with mortality. So when I talk about health outcomes, those are things that I'm actually talking about. In some populations, you can have many people dying because of preventable diseases compared to another population. Okay, and that means that there is disparity. There is one population is having poor health outcome, whereas the other is having better. And this, if it is because of unfairness and unjust political decision or decisions or resource allocation, whatever it is, then we say it is health inequity. Okay, there are some health disparities that are avoidable. Okay, and if that happens, we have what you call health inequity. Health equality is a concept that actually describes the fact that you want to have people having similar health outcomes, okay? But inequality is when you have people not having, or different populations not having similar health outcomes. That is inequality. That difference can be because of the genetic makeup, it can be because of many factors. But if the difference in health outcomes is because of unjust decisions, then that is what you call health inequity. So resources should be shared fairly and in a just manner to prevent what we call health inequity. So we can promote health equity if we allocate resources equitably. And then we always have to deal with issues of making sure that people can do what they want. That is what we call individual choices. But they should not do everything that they want at the expense of public health. Okay? So for example, a person who makes a choice to drink or smoke, let us say smoking, for example, you can't be smoking everywhere because it is your choice. Because if you're going to smoke everywhere, it means you're going to affect other people who are not smoking. And that has health implications. So there should be a balance between managing individual choices, that if you want to smoke, you can smoke, but don't smoke at the expense of the health of others. So let us look at the history of public health ethics. Okay, I don't know why this one is here. Okay, so public health ethics has its roots in early civilization. In early civilization, there were beliefs that diseases can be prevented at a community level, okay? And therefore, the emphasis was that communities should take charge of protecting health. Later on in the 17th and 18th century, the emphasis was now about the government or the state coming into active roles in promoting the health of its citizens. Now, in the late 20th century, the concepts now kept changing because public health problems also started growing. And therefore, concerns became very prominent. One major event happened in Germany, in Nuremberg actually, where physicians conducted research on participants and this research was not ethically approved. It was dangerous, and many people actually died because of participating in the research. And then after the World War, a committee or a commission was instituted to investigate what actually was happening, and that they revealed gross mistreatment, inhumane treatment of the research participants that resulted into disabilities and death. And that commission gave rise to what we call the Nuremberg Code, which stipulates the guidelines that researchers should follow if human subjects are to be involved in the research. The emphasis was more on informed consent, voluntary participation, and protection of the research participants' rights and welfare. Then in 1979, the Belmont report was released, still outlining the key ethical principles that should be followed in research if we have humans as the subjects. Emphasis was placed on beneficiency, justice, for conduct of research. And then in issues to do with bioethics, there were a lot of issues that were emerging in the field of bioethics. And actually, this is for you to realize that the field of public health has origins in bioethics. Okay, so the changes that happened in bioethics had influence in public health. Okay, and bioethics expanded to include issues like genetic testing, issues of reproductive technologies, and issues of palliative care, what we call end-of-life care. These are all major shifts or major developments in bioethics that actually had influence in public health ethics. Now, currently, public health ethics still maintains all the other principles that we have talked about, but there is a renewed focus on issues to do with health equity, which I've described several times, and social justice, and making sure that basically these issues of health equity and social justice are related to making sure that populations don't have widening health disparities. Okay, so for example, if you look at the concept, the context of South Sudan, you could realize, for example, Central Equatoria having many doctors compared to any other state in the country, and many nurses, many midwives, many hospitals actually in Central Equatoria. Juba alone has a lot of health facilities, private hospitals compared to any other state. Okay, so that means that it is most likely that the health outcomes of people living in Central Equatoria are better than people living in other states. Okay, so the emphasis is that regardless of where you're staying in South Sudan, you should have the same health outcomes as others. Another very important aspect is an issue to do with global health ethics, which is the fact that we have a lot of widening health disparities across countries, yet we really need to work together. How do we work together in terms of international collaboration, resource allocation, and other things? These are important aspects that have implication on practice of public health. So let's look at some of the major key issues related to public health ethics. and in terms of practice also. We shall look at others in the next presentation. The first one being public health surveillance, which is about collecting and analyzing health-related data and using that data to inform decision making and control the spread of diseases. However, when you collect data, you are most likely going to infringe on people's privacy, and issues of informed consent are going to arise. And therefore, in the practice of public health, we need to have a delicate balance in collecting health data. And then interventions that are aimed at preventing diseases, still the issues of informed consent and not forcing people to be involved, and also issues of autonomy play an important role, and we need to balance them. And then research, which we have actually explained in the Nuremberg Code, that people should be given all the information they need such that they can make informed decisions whether to participate or not. But the researchers should take keen notice or keen interest in protecting the participants. And then also coming to the ethics of the disaster preparedness and response. If you have mass casualties, you have many people who have died. Who are you going to treat and who are you going to leave out? So these are issues of triage, but also who are you going to devote a lot of your resources on compared to the others? For example, in the COVID-19 pandemic, some hospitals or in some countries, oxygen became very scarce. So who are you going to give oxygen and who are you not going to give oxygen? The general pattern was that the elderly patients who had little chances of surviving were not being given oxygen, and oxygen was given to those who have high chances of surviving COVID-19. So resource allocation is an issue when you have a mass, if you have a big health problem, for example, an outbreak where the resources are stretched. And then also there is need to balance autonomy and the rights, autonomy and rights with public health goal of protecting the population. This is like a recurring song that public health professionals will always face. If you have someone who is perhaps having a contagious disease, do you want to protect them such that they cannot cause the disease to the others, or you leave them to enjoy their autonomy and freedom and liberties? Those are issues that have to be navigated. Okay, I think that's the end of this presentation. Generally, in conclusion, we can say that public health ethics allows us to make decisions in different situations, whether it is in allocation of resources, control of communicable disease, whether it is in research. It provides us the guidelines on how we make those decisions. So if you have any questions, please ask.